this Zoom is quiet, but usually it says this meeting is being recorded. Okay, let's start to keep conscious of time. Welcome everyone, and thank you so much for joining our webinar today. We have Drs. Tamara Summers and Laura Hanson representing the Clinical Studies and Methodology Core of the PCRC, and they'll be speaking their webinar, Need Better Peer Review Skills for Palliative Care Manuscripts, Mentoring and Being Mentored. So just a couple of housekeeping items. All attendees are muted and video cannot be turned on unless you ask. We also ask that you please use the Q&A feature to type in your questions. And if any questions that come up are more technical in nature, like if you're having trouble hearing, we ask that you please use the chat feature. You can chat me and I'll do my best to help. Please share your questions and comments at any time, and we'll have plenty of time for Q&A towards the end of the webinar. We have a large panel today and many introductions to go through, but first I would like to introduce Dr. Jean Kutner, co-chair of the PCRC, and now I'd like to turn it over to Dr. Kutner and please formally introduce our moderator.
Wonderful. Thank you, Naomi. And thank you all for joining us today. I know I'm very much looking forward to our session and really happy to be here with all of you. So I get the pleasure of introducing Dr. Tammy Summers, who is an associate professor in the Department of Psychiatry and Behavioral Sciences at Duke University School of Medicine. She is a member of the Pain Prevention and Treatment Research Laboratory at Duke and a member of the faculty at the Duke Cancer Institute. She also serves as co-director of the Clinical Studies Core for the Palliative Care Research Cooperative Group. So Tammy, take it away.
Great, thank you, Jean. Thank you again, everyone, for joining us this Friday afternoon for our webinar and some quality time with the PCRC. So we're excited to be talking with you about the important topic of palliative care manuscripts, which we know are one of the best ways to disseminate the knowledge we have. And we have a really nice lineup of experts to discuss this topic. I'm moderating this webinar as a co-editor for the new section of the Journal of Pain and Symptom Management, focusing on methodological reviews for palliative care research. I also am an associate editor for the Annals of Behavioral Medicine. So I'll provide you a bit more information on JPSM's methods section in a moment, and then introduce you to two fabulously well-positioned individuals that will talk specifically about manuscript review in the process of mentoring and being mentored for manuscript review. Following that, we have a good lineup of panelists to have a discussion about manuscript review and mentorship for review. And as Naomi mentioned, if you'll use the chat feature, the question and answer feature, we'll try to get to all the questions that we have at the end. Next slide, please. One more slide, thanks. So as many of you know, the PCRC has formed a new collaboration with the Journal of Pain and Symptom Management. Laura Hanson and I serve as co-editors for this new section on methodological reviews. This section of the journal is focusing on manuscript addressing original research and important methodological issues related to palliative care and hospice research. Next slide. So in the past year, we've been busy in this section. Many of you have been solicited by us to review manuscripts or to submit manuscripts. Here are the first several manuscripts in this section. These publications have been on the topics of cluster randomized trials, developing psychosocial interventions for patients with serious illness, consent and palliative care research, and measuring goal concordant care. So congratulations to the authors of this important work, many of them PCRC members. There are several topics, next slide please, Naomi, thanks, that we've identified as being of interest to this section of the journal. These include measurement methods, study recruitment and retention, research design, research innovation, stakeholder engagement, and analytic methods. We're also very open to ideas that you may have. You're welcome to submit or to run those ideas by Laura and I, and we can maybe help shape them, kind of yay or nay, either way. We've done a lot of that with folks. The article characteristics, just so you have some idea, they're quite short. So the maximum is 3,500 words with narrative abstracts and structured headings. And there's more instruction on this on the journal website. Next slide, please. So there's a number of ways that you can get involved as a PCRC member in this research. First, we encourage PCRC members to submit their work in this area to this section of the journal. You can email Laura and I if you are planning to submit something. This is helpful for us to get it triaged to the right section. Second, we have been recruiting a select group of journal reviewers from the PCRC to work in this area. Third, we're working with the journal to create a mentored review program that will pair more experienced reviewers with less experienced reviewers. We know this is a really nice way to develop skills in manuscript review. So this webinar is actually one of the first activities that we have done around this mentoring and mentoring for review program. So again, any of these, if you're interested in any of these, we'll have another slide towards the end. Please reach out to Laura and I, and we're happy to give you more information and get you signed up. So first today, to talk to us about this process is Dr. David Casarett from Duke University. Dr. Casarett's a professor of medicine and chief of palliative care at Duke. He's coming to us today in the role of editor-in-chief of the Journal of Pain and Symptom Management. We feel really fortunate, David, to have you here to present this part of the presentation. Thank you for taking time away from your vacation, it sounds like, to do this for us today. So go ahead and take it away. Thanks.
Great, thanks so much. Can you hear me okay? Yeah, great. Sorry, we're in a vacation house, so internet is sort of unreliable. At least my picture looks professional. As Tammy said, we're on vacation, which means a semi-naked 3-year-old toddler may appear around the corner at any point. So please beware. Next slide, please. So I wanted to give you, I guess, two aspects to the publication process. One, Tammy and Laura asked me to walk through just what happens backstage. And then to give some thoughts from my perspective about what makes for, I was going to say a good review, what makes for a helpful review, and what makes for a not so helpful review. So the backstage process of publication, this is what happens at JPSM, but it's not so different from other journals, really. There's an initial submission, usually some initial review by a combination of staff or associate editors or the editor-in-chief. At JPSM, every manuscript that comes in gets reviewed at least by our managing editor and by me. Determinations are made if a manuscript is out of scope. Those are sent back to the author. If it's within scope, then by default, every manuscript gets reviewed by also an associate editor. So the vast majority of our submissions get reviewed by at least 2 people, sometimes 3. We'll often call in others to take a look as well. Some of those are sent for external review. And at that point, and this is again pretty standard across other journals, decisions made are either to reject, ask for a minor revision, or a major revision, which is also at some journals known as a revise and resubmit letter. And then when manuscripts come back again, those are the options: reject, minor revision, major revision, or accept as is. Some of our manuscripts, when they come in as a revised version, will go out for a second review to 1 or 2 of the reviewers who reviewed them previously. That's not standard, though. That doesn't always happen. But this is the overall course that probably 99% of our manuscripts follow. Next slide, please. Thanks. So I'll give you a couple slides on what's helpful, and one is about what's not so helpful. And honestly, for me, I think what's most helpful often is the general overall comments, which are more useful than pointing out either typos, which is certainly useful, or errors in tables or problems with the way that results are presented. All those things are important, and I would encourage you as reviewers to please do that. But as I look at a review and think about what's really most helpful, it's some of the overall comments, which I mentioned because those are sometimes the comments that are easier to make. It's really hard and time consuming to walk through a paper and figure out inconsistencies in some of the results or potential errors in the table. It's often much easier and coincidentally more valuable to give us some insight into some of these questions. Is it novel? I mean, we're sending this to you as a reviewer because you know the literature. Is this really a contribution, or is it duplicative? Does it make a contribution to the literature, and would it change clinical practice? And that's, by the way, a question you could ask whether you're predominantly a researcher or a clinician or both. And then derivative questions, I guess, about whether the paper is biased or slanted or tendentious or tends to drive in a direction that's not supported by the data. And last but not least, sometimes there are some conflicts of interest. Either investigators have a stake in a company that's sponsoring a study, or other potential conflicts that we as editors, not knowing the specifics of this particular area of this particular field, aren't aware of. And we really appreciate it when you bring those sorts of things to our attention, because we won't know otherwise. Next slide, please. Taking a couple steps back, I tried to think of some other aspects of a review that are helpful, and it's really the first one. That is I think most important, most useful, most helpful, both to us as editors, but also to authors. I mean, taking a collegial tone, pointing out opportunities for improvement in a constructive, critical, but constructive way. Going along with that, an opening positive statement doesn't have to be long, but saying something like, this is an interesting article that's well written, if in fact it is, on an important topic, if it is, addressing a problem that is common, if that's true. It's like whenever we give feedback to a learner, you start with something positive, making focused comments, keeping it organized often in terms of overall comments, which relate to whether work is duplicative, important, would change clinical practice, and then following that by more specific comments, just walking through the manuscript paragraph by paragraph. Please do take the opportunity to make confidential comments to the editor. I think all journals, JPSM certainly does, has that window at the top of the review. Doesn't have to be long, but if you have thoughts about potential conflicts of interest or other issues that you don't necessarily think you can frame in a way that's collegial and constructive, the comments to authors, please share them with us, and we, of course, will keep them confidential. And then also thinking in terms of length. We're not asking you to be editors, but certainly you're in a great position to say, this could be said in the length of a brief report. I mean, you have a sense of the subject matter, you've read the paper, you're in a perfect position to tell us, yeah, this is valuable, it's important, but you could strip it down. And then last but not least, please do take a moment to proofread your review. It doesn't change the meaning, but when an author gets a review that has errors of syntax or grammar and spelling, it reduces that author's confidence in what you're saying. In the same way that you see a clinical note, for instance, and it's worded in a way that's awkward, difficult to understand. You have some questions about the skills of that clinical provider, or at least I would. So just take a moment to preview quickly. I think that's all I have. Happy to answer questions at the end in the panel, but hopefully that's enough guidance to at least get you on the road. Oh, right, one more. Yet nothing is really not constructive. I think anything that you could suggest to make the paper better is helpful. I think what I would avoid, though, is language or a tone that's unnecessarily critical. If you could think of a way to say it in a way that's more positive, or look, I mean, we've all, I think everybody on this call, on the panel and in the audience, have had papers rejected or grants rejected. So just take a moment, put yourself in the position of that author who is going to be reading your comments, and think about whether the comment or the way it's phrased or the tone in which it's couched is something that you would like to see, particularly if it's at the end of a bad week where you've gotten 2 other rejections and you're really feeling despondent about the way your work is going, is this really the language you would want to see? And then obviously, but it's amazing to me how often it comes up. I think many reviewers have a really odd, but I guess understandable tendency to unblind their identity by listing out papers that should have been cited, all of which have this one reviewer's name on them. So that's one obvious reason not to promote your own work in your reviews. But it also, I think, biases the review. So also be careful about self-promoting suggestions to use one of the instruments you've developed or to cite a paper that you have written, even if that is the perfect paper. Resist that temptation. I think that really is it. Yes, thank you.
Sounds good. Thanks, David. That was great. Good to hear kind of an insider's perspective on, you've seen a lot of these come through. So it's nice to hear that. We do have a really quick question about considering review articles from Africa. I'm assuming that the answer is yes, but I thought since we have you here that I would let you field that.
The short answer is yes.
Yeah.
We consider review articles globally. In fact, I think I'll say briefly, we do have, Ronit Elk is our global health editor now. One of the moves I made when I took over the journal a year ago was to appoint some subspecialty editors, including Laura and Tammy. Ronit is our global health editor, and that review article would go to her. And she is very passionate about increasing the global reach and impact of the journal's work and publication. So the answer is an emphatic yes.
Great, thanks. Thanks so much. So next, Laura Hanson's going to talk to us about mentoring and being mentored for manuscript review. Dr. Hanson is a professor of geriatric medicine and medical director of palliative care at the University of North Carolina, Chapel Hill. She's a founding member of the PCRC and currently leads the PCRC Measurement Core. Dr. Hanson's a co-editor of the new methods section of JPSM that focuses on methodological reviews in palliative care research and has a number of experiences reviewing, writing, and also editing manuscripts for journals. So Dr. Hanson, I'll turn it over to you. Thanks.
Great, thank you, Tammy. Go ahead to the next slide, please. So I am going to shift our gaze a little bit from journal manuscript submission and the review process, which David Casarett so carefully went through, and really shift our gaze to how it is that we in the field develop and transmit the skills that he described in a good approach to peer review. And I'll just have to say, to start off, one of the things that really probably many of us in the audience can resonate with is that these skills, as critical as they are to scientific rigor in the field of palliative care, are rarely taught and mentored and passed on. So we really wanted to do this webinar to provoke a discussion among all of us about how to do this better. Because really everything about the advancement of science, because science done without publication and dissemination really goes nowhere, is contingent on the peer review process itself being sound. So just starting off, the real way to transmit these skills is through mentoring, and peer review of another individual's scientific writing is a skill that we all really need mentoring in order to acquire. The word mentoring, the term mentoring, comes from the Odyssey. And when Odysseus left for the Trojan War, he was gone a lot longer than he expected to be. He entrusted his son Telemachus to mentor, who was a teacher, an advisor, and a protector to his son, who was young, developing, and relatively vulnerable at the time that Odysseus left. And the charge that mentor had was to help Telemachus mature and become an independent adult man ready to assume leadership. That's really where our idea of mentoring comes from. And mentoring is really a dynamic and reciprocal relationship between someone who's experienced in a field and somebody who's an early stage worker in that same field. And you could argue that the skills we need for peer review really require that kind of relationship in order to develop well. Another characteristic of mentoring is that it's both voluntary. You don't get paid to do it. You don't get assigned to do it. It's a mutually agreed upon relationship, and it's purposeful. Mentoring doesn't happen by accident. It happens because two people agree that this is something that they're going to do together. And probably most important for the members of the audience who themselves are more junior is that mentoring is overwhelmingly a variable associated with academic success. So with mentoring, you are much more likely to be successful. Next slide. So I want to give a shout out to those who are participating in this webinar who might be ready to mentor others for peer review. So think about yourself as a potential mentor in peer review if you're somebody who's already kind of navigated the publication process. This is a ballpark number, but maybe you have 20 or more peer-reviewed publications in. That might not seem like as many as you wish you had, but the reality is you've weathered this experience and you have some insight into what makes a helpful peer review and what makes a not helpful peer review. And all of us have experienced both types. So you have enough experience to start to reflect on what it takes to be helpful. Your relevant knowledge is really built on that experiential learning. You have experienced helpful peer reviews that made you say, oh yeah, I should have thought of that. Or, oh, I hate that I have to rewrite this part of my discussion, but now that I've done it, it's actually better. I have had experiences of peer review where I really wish I knew the names of the peer reviewers so that I could thank them because they improved my work. We've all experienced less helpful peer reviews. Ones that come in with that less than collegial tone, ones that come in that were clearly done late at night without a lot of thought, without closely reading the manuscript that we so carefully put together. So you may have also read or learned things about effective peer review beyond your own experience with being a recipient. Perhaps you have even become an associate editor, or you've done seminars or training at a professional meeting. And then think about your relevant experience. How often have you done peer reviews, and which journals are you reviewing for? If all of these things are coming together in your mind as things that you actually have experience with, then you're ready to be a mentor. You're somebody who can help begin to pass these skills on to the next wave of individuals who are going to be doing peer review in our field. Next slide. I think it's also important to ask yourself, am I someone who should seek mentoring as an early stage peer reviewer? And really, most of us learn peer review on the fly. We just got told that we should do it, or somebody sent us a manuscript and we said no the first couple of times, and then finally we said yes, and we did the best we could. But if you are an early stage investigator, I want to encourage you to think about seeking out mentoring as you develop your peer review skills. One way to think about this is I'll bet that you have publication goals for yourself. Maybe you have a few peer-reviewed publications in the field, but you really struggle with research writing. You really struggle to get that big project that was so exciting to do down on the page in succinct language that makes sense to others. Boy, this is one way to improve your own research writing. It's reading with a critical eye other people's research writing and thinking, how are they getting this across with clarity? Where are they leaving gaps in the science? That can really help you with your own publication process. And then frankly, it's a great way to develop research skills because you're looking into the research minds of many individuals who are publishing in the field of palliative care. It helps you become more skilled at interpreting research. It helps you, and I love this part of the experience personally, sift the wheat from the chaff when reviewing a research topic area. How many times have you gone to the literature to try to understand the answer to a clinical question or one of your sort of background reviews for your own research and thought, oh, there are hundreds of manuscripts out here. I don't know how to begin. I don't know how to separate what's good and reliable and valid from what's not very useful. Well, there's nothing like the peer review process to help you develop those skills. And ultimately, it helps you get better at designing your own research. Next slide. But this isn't something that's easy to do. And I want to really challenge you to think about establishing a mentoring relationship in order to get better at peer review. It's sort of a given that what Odysseus did is not going to happen very often. Odysseus thought ahead, said, I need a mentor for Telemachus, and organized the whole thing. But in our world of academic medicine, nursing, social work, the reality is it's often the mentee who needs to take initiative, or the mentor who's super organized, who recognizes this needs to be part of a mentoring relationship. So I'd encourage you to think about this and be purposeful. Ask someone to mentor, to work with you as a mentee in order to develop your peer review skills. Ideally, it should be someone who works in a related content and or methods area for your own research, so that the types of manuscripts that you might be reviewing in a shared approach will be manuscripts that interest both of you. It may or may not be a person who's a mentor or a mentee for your own research projects. So it's entirely possible that you would ask somebody to be a mentor for peer review who you've noticed has really great writing skills. They might not be your primary research mentor, but they might be somebody that you really want to learn from. Or it might be somebody in your research group who you've learned is an associate editor for a journal that you aspire to publish in. That would be a terrific person to ask to mentor you in peer review skills. It's very likely that this person will be someone working at your institution. It's possible to establish a distance mentoring relationship, and the PCRC network might even be a place that you go to look for a distance mentor for this purpose. But it's also very likely that the person you engage with is somebody that you engage with around other issues and likely is working in your own home institution. Once you've identified somebody, you have to speak to them about it. So as I said, be purposeful. Make sure that both of you understand that you'd really like to engage together around this particular skill development. And then create a time-limited plan to work together on these skills. A time-limited plan might be built around setting a goal number of reviews that you do together. Maybe 3, maybe 6, maybe 10, but set a goal. Have an idea of how many of these reviews would be helpful to do together. Set an agreement on how you plan to work together. And I can talk a little bit more about that, but set expectations. Set expectations for the way that you will be working together as mentor and mentee. And then finally, it would be a good idea to set expectations for a time commitment. 6 months is my estimate about a good length of time to work together to help expand these skills and develop experience. Next slide. So in this partnership between mentor and mentee, it's important to think about what the mentor is agreeing to. If you are purposeful and you say, we are going to do this together, then the mentor should agree to do a few things. The mentor should enroll as a reviewer with JPSM, since we're talking about this as an effort for one of the major peer-reviewed journals in our field. But realistically, the mentor should also enroll as a reviewer with other journals that are relevant to your shared field. If you picked your mentor right, they are probably already reviewers for those journals, but realistically, it's a good question to ask. The mentor should agree to mentee's welfare and academic peer review skills. And what this fundamentally means, like everything else in mentoring, is that the mentee is the one who gets credit for submitted peer reviews. These are submitted in the mentee's name, not in the mentor's name. The mentor should agree to provide examples of their own peer reviews, either ones that they've received for their own work that they think represent good practice, or ones that they've written that they believe represent helpful peer reviews. The mentor agrees to provide edits, basically to read draft peer reviews that the mentee has written and provide suggestions, feedback, and edits on those peer reviews in a timely way. And like everything else a mentor does, a mentor should be teaching directly and teaching by example. Next slide. So what if you're a mentee? If you're in this purposeful mentoring relationship or peer review, what are you agreeing to? Well, you should enroll as a reviewer with JPSM and other journals relevant to a shared field. You know, interestingly, one of these things that probably no one's suggested that you do, but it's an easy thing to do. It's easy to join the reviewer pool and provide information on the types of methodology or the types of content area that you believe you have the expertise to peer review. You should demonstrate to your mentor that you have ambition to improve your peer review skills. You're not just doing this because your mentor suggested it. It's actually something that you truly want to work on. Mentee agrees to provide timely draft peer reviews to the mentor for review. And I want to really emphasize the word timely here, because in order for this work together to be successful, you have to recognize as an early stage peer reviewer that every journal is working hard to turn around the peer review process quickly. It's very important that once you agree to do a peer review, that it gets back to the editors of the journal within a very short number of weeks, ideally days, but at most a very small number of weeks. think about it when you're on the receiving end, when you're the writer of a manuscript. It's incredibly frustrating to wait for 4 months to hear anything back from the journal. But what the journal is waiting for is that peer review to be sent back. So I would strongly encourage you again to set time windows. When you agree to do a peer review, set yourself a time window and get it turned around quickly in a way that also allows your mentor approximately a week to look at it, provide edits and feedback before it's finalized and sent in. A final point that the mentee is really agreeing to do, and again, this is kind of broadly a mentee's responsibility, is to organize and coordinate the workflow of these shared peer reviews. Ultimately, the mentee will get credit for these peer reviews. Ultimately, the mentee is benefiting through skill development. But in order to accomplish those goals, it's important to take responsibility for coordinating the workflow between you and the mentor to get it done. Next slide. Now, I'm delighted to say that we're ready to turn this discussion over to our panelists, and David and Tammy and I will also be available to allow us to have a conversation about this process, the process of manuscript peer review and the process of mentoring and being mentored in order to enhance those skills.
Great. Thank you, Dr. Hanson. Made me think a lot, wondering if I'm a mentor or a mentee on manuscript review. I think that was a really good overview and something we probably don't talk a lot about, but should. So it's hard to introduce these three quickly, but I'm going to give it a good shot. So on our panel today, we have Dr. Ashley Leek Bryant, who's an associate professor at the University of North Carolina, Chapel Hill. Dr. Bryant has served as an associate editor for the Clinical Journal of Oncology Nursing, guest editor for the Gero-Oncology Supplement for Clinical Journal of Oncology Nursing, and guest editor for the Acute Leukemia Supplement and Seminars in Oncology Nursing. Thank you, Dr. Bryant, for being here. Next, we have Dr. Bob Arnold, who's a professor in the School of Medicine at the University of Pittsburgh. He's the chief medical officer at the Palliative and Supportive Institute at UPMC. Dr. Arnold has extensive experience publishing peer-reviewed manuscripts in the area of palliative care and reviewing these manuscripts, I'm sure, as well as editing. And then finally, we have PCRC's Dr. Jean Kutner. Dr. Kutner has recently served on the editorial boards of the Journal of Pain and Symptom Management and the Journal of Hospital Medicine. So thank you to you three for being here to discuss manuscript review, as well as mentoring and being a mentee for manuscript review. We have several questions here and we can kind of jump into those quickly. So Dr. Bryant, I saw that you had said that you would answer the first one here. And the question is, what are some ways to train mentees and students in peer review? Would you suggest sending a paper to a mentee, conduct the reviews separately and go over the reviews? Since the reviews are confidential, are we allowed to share the paper with a mentee?
Great, lots of great questions there. So thank you again for the invitation. I will say the last question you had related to the confidentiality of that, I may have David answer that or someone else. But I would say that I think it's a great opportunity whenever a mentor is able to support and mentor a mentee in this role. So I would encourage, if it's allowed, for you to both review it separately and then come back together and kind of see where the gaps are, where were you both thinking the same thing. So that's kind of the take on, and that's what I've done before with other students that I've worked with.
Great, thanks.
And if you don't mind, I would like to add to that answer, Ashley, just in the spirit of discussion. I totally agree that one of the ways that people sometimes get a first taste of mentored peer review is that the mentor mentor has agreed to be a reviewer. But then after agreeing to be the reviewer, so in other words, they are going to be the formal reviewer, they recognize that they can engage a mentee in a discussion of the peer review process. That is something that I would love to have David comment on in terms of confidentiality, because in general, we are asked not to show manuscripts that we have agreed to peer review, but would love to have David comment on that as a journal editor or any other panelist.
Well, I must say that I do that a boatload because I get asked to review way too frequently. And if part of my job is to help other people learn how to review, I'll often ask. Everybody says yes. I mean, Lord knows they want you to say yes. That's why they asked you. I also think that for those of you who are trying to learn how to review, there are like 70 gazillion really great articles out there in Chest and Jujum that are about how to review an article. And before I let people review, I send them 7 articles and say, read these articles about how to do a review, because there is a literature out there and they shouldn't learn it on their own. And it might be really great for PCRC to, in fact, put together a series of here are the top 3 articles on how to review that people could use to help mentor.
It's a great idea. Just to follow up on that, there's a question here about, would the journal, or is it appropriate for the person that is asked to review to notify the journal that they'd like to involve a mentee?
I would say definitely. I think this is Jean, somebody asked a question about the confidentiality piece of it too. And it'd be good to hear from those of you that actually are editors, but I think it's probably good practice to write back and say, is it okay? Or I'm going to involve a mentee in the review process, just especially since we all say when we agree to review that we're going to keep something confidential.
Yeah, this is David. I would encourage you to ask us. We will universally say yes. More eyes are better as a universal rule. We would just ask that you share with whoever you're sharing the manuscript with to adhere to the same standards of confidentiality that you yourself adhere to. That would be our only request, which I think is pretty non-problematic.
So another question is, how do you consolidate comments from reviewers who have polar views of your paper? And so a number of examples are given here, but I think we've all experienced this to some degree if somebody wants to jump in and answer. So you have one reviewer that says one thing and another that says something else quite opposite. How do people handle that, or how would you suggest handling that?
Well, first, what you do, let's be honest, you say mean things about the people who didn't like your paper, and you praise the brilliance of the people who got it right. I mean, that's what all of us do. Then it seems to me you get to make choices. Remember, their reviews, you can't do what everyone points out. And you might say there was a range of comments about this point. And, the question is, can you be responsive in any way to that range? And sometimes you have to say, given that reasonable people disagree about this, we've decided to leave it this way. I don't think there's a single right answer other than that I promise you all of us speak badly, at least initially, about the reviews that didn't say what we wanted them to say.
Yeah, and I think to piggyback off of Bob, I think it's sort of like responding to grant reviewers. Similarly, it is, making sure that you acknowledge, because you don't want to just ignore that somebody said something, but in a very polite way to explain either why you're not changing something, or why why like not saying, like, how could you be so ignorant? But just say, thank you for this comment. And here's either how we have addressed it or we haven't addressed it, and recognizing that, people are people, and people are going to have different opinions, but it's really up to you as the author to describe why you're responding in the way you are.
The only other comment I would add would be, whenever you submit your initial manuscript, usually you submit a cover letter. And I would then resubmit another cover letter just saying, there were some polarizing views from the reviewers, and this is how I plan to address it. So I think it's okay to do both, acknowledge it in the cover letter, but also in the response to the reviewers.
It is good as an initial reviewer and a mentor to read the other reviewers' comments, though, because that's what this is about. And so if I wrote a review and Jean or someone else wrote a review and they completely had different comments than me, I need to go back and reread it and say, did I, is it was unclear? Did I misread it? Do I stand by my view? We've all done this at grant reviews, right? Where someone gave it a 1 and I gave it a 5, and it's like, And so you just need to understand that we are people and we bring our own set of eyes to the review. And yet it's a learning opportunity for me as a reviewer.
Yeah, Bob, it's always the first thing I do when I get that nice letter from the editor saying, thank you for your review. Here was the decision. It's always the first thing I do, and read what everybody else said.
Right. And I say, oh my goodness, I should have picked that up, or I didn't notice that. It's a learning opportunity for me.
Great, thanks. So there's a comment here that says that several of the American Psychological Association journals, there's a place to tell the editors that you're including a Minty in the review. So I think that's good to know that we can look for that in some journals along the way. So another question for the panel is, what do you look for right away in a submitted article that might give you a sense that it might be a good article? And conversely, is there anything that turns you off really quickly? Yeah, go for it, Bob.
The question is, when I read the introduction, it's like reading a grant. Do they tell me what the gap is? And they tell me what their aim is? Mm-hmm. If I read, I'm not a big reviewer of abstracts, and that's a personal thing. But if I read the introduction and I have no idea what the question is or no idea what they're trying to do, I have a pretest probability that is above 70%, that it's not going to go well. The introduction, they get 3 paragraphs. They need to tell me what the argument is and how they're going to add to the literature.
I actually read abstracts, Bob. So I start with the abstract, and sort of the same thing though. It's like, do I understand what they're trying to do, and is the findings or the conclusions, depending on the type of article, is it clear? And if I'm struggling with the abstract, I think, oh God, what's coming? But if the abstract's crisp and clear, and the abstract should get me excited to read the rest of the article. I'm curious, Ashley, what do you do?
Well, I think as a clinician researcher, I really go straight to the implications for practice and conclusions. I really like, what's the meat of this? And then I can go back and see what was the purpose, what was the aim, what methods did they use? But I'm more of a practical, let's see what the abstract says, because I can really get the objective of the article right there. And if I feel like they kind of pull something together at the last minute and they threw nursing in there or threw something about palliative care, I need to rethink that.
Yeah. So to follow up on that, if you find that article that you say this is not going to work, how much effort do you give it in review? And how do you address that? Because often they're harder to review.
My job is to be helpful. My job is for the person who reads my review to say, oh, I could have done this. This is what I could do to make it better. I need to be really careful. My job isn't to say, I wish you would have done this project. They didn't do that project. I hate those reviews. I did the project I did. I might say, could you look at this analysis? My job is to be a kind editor that will give them a way to make their paper better.
Yeah, I think for those ones especially, I think David mentioned, not getting into the typos or grammar correction. I think for those ones, it's really more those more sort of maybe global or higher level comments on whether a section needs more clarity or better explanation or something rather than line item editing. I think that can drive you crazy.
I want to just pitch that I think there are a couple of situations where a very short summary review is appropriate. One is if you read it and you think this audience is way off. This is actually a good manuscript or an interesting study, but the audience relative to this journal may not be appropriate. And the other, honestly, which is heartbreaking, and I don't think we see that often, is if you see something that you think, we call them fatal flaws, but if you see something that makes you believe that there is something about this science that is not really fixable, I think telegraphing that, I totally agree with Bob's comment. My job as a peer reviewer is to be helpful and help move the science along. But every now and then there is something that I feel sadly may not be fixable or maybe cannot be moved along.
Thanks.
And I think to add to that, I would just say also, when I have those type of reviews, those take me longer. So I don't do that in one sitting. I may need to break that 2 or 3 times over a week to really say, let me make sure I'm clear on what I'm requesting. And, am I being very, am I explaining things clearly? I understand that something just A and B didn't make sense to me, and I think that's important because you're right. They took the time to submit this review and they really want to get feedback. And oftentimes then once, we receive that decision that person, it's either a revise and resubmit or rejection, you're absolutely right. Let's look at the other comments from the other reviewers and say, yeah, we all were on the same page. We all thought that article needed more work. And then sometimes those kind of articles, I think, need to be a brief report, right? It needs to be something shorter. It could just be, discussed at a conference. But I just think sometimes all the manuscripts that we see, I'm not sure if they all need to be published. I think there's other ways and other mechanisms for that to happen.
Thanks. So Tanya, I think we made use that you could ask a question if you have one. You're on mute. I don't know if you're asking or.
Hi, everyone.
Hi.
Yes, the question I have is, would it be kind of like reasonable for like a mentee to give, like when he or she's relating to a mentor in terms of reviewing an article, can he say, give me assignments, give me stuff that's not really like a real, maybe like a real journal work? Is there any place for that kind of thing? Assignments, do this. The mentor says, do this. Let me see. Instead of using an actual manuscript, is there any place for that?
Do you mean to learn how to review?
Yes.
So Tanya, I'll take that one. I actually think that occasion arises all the time, which is in sharing a writing group within your field. So thinking about having mentees review a mentor's manuscript before it's published, or sharing among mentees. Maybe there are 3 mentees and one of them is getting something ready for publication. The other 2 mentees have not been involved in that project, but can actually serve as preliminary peer reviewers and give constructive feedback to improve the manuscript before it's actually submitted. So I think that opportunity arises often. Again, it takes being purposeful. It takes formalizing that process, agreeing to do that sort of thing for one another in order to make it an actual part of your development as an investigator. But it is very appropriate to ask for.
Great question. So we have another, I think, interesting question here. So how do you keep track of your reviews? And do you need to keep track of how many reviews you've done for promotion?
This is Jean. I do not keep track of how many reviews I've done for promotion, and I write a lot of promotion letters, and I guess and I used to promote people when I was division head, and I got to say that's not a metric I ever looked at. I think the reason actually to keep track of your reviews is the opposite side of things. I'll pass on some advice back to the mentor discussion that I got from one of my early mentors, is that you should never be reviewing more papers than you're writing. So maybe that's one way to balance those two.
Yeah, I don't think it should be even close. Because the problem is that the more you review, the more they'll ask you to review. And I think that, you need to figure out if you're giving a gift to the field, and yet you don't have to give charity once a week. You can give charity once a month or once a quarter, and you should be intentional about it because it is a gift to the field, and yet you have your other things to do. I keep track of it because I have enough other stuff that then I'll forget. So I'll just put a reminder in my to-do list when I know that it's due. Although some of the journals now are really good about letting you download an Outlook reminder that will go into your Outlook calendar that reminds you. I'm a very on my plate, off my plate kind of person. So if I agree to do the review, I do the review in the first 48 hours. A lot of people don't do it that way.
So we have one final question. Let's see if we can get this in here before the top of the hour. But does serving as an associate editor help your writing? And at what stage of your career should you get involved in such an opportunity?
I'll start. Oh, go ahead, David. No.
But there's probably room for both of us because my answer is short. I'm actually not sure it does. I think for the reasons we alluded to in the last discussion, earlier in your career, you should focus on advancing your career and publishing and getting funding. And I'm not sure being an associate editor really helps. And it's potentially a huge time sink. I think being a reviewer does help or can help. And that's probably where I would focus and save thoughts about an associate editor role for when you have less pressure for promotion. That'd be my thought.
I agree.
I would argue what helps your writing is writing and getting feedback on it. And a lot of being an associate editor is administrative work. If you want to be a good writer, write every day, have people critique your writing every day.
Good. Great. Thank you, panel. This was really nice and good advice to hear. Thank you to everyone for being here as well. So on the screen now is a way to get involved. Take a quick picture of it, write down our email addresses. We've definitely been using folks for review, and we are excited as we continue kind of forming this partnership for mentoring and being mentored. So please be in touch with Dr. Hanson and I about the journal and also thinking about writing articles for that section.
Okay, thank you, Dr. Summers, for moderating today's excellent panel discussion. And thank you to everyone who's joined. We've just reached the top of the hour, but I want to remind our attendees that if you do go to our website, we have one more webinar that will be posted in the near future, and that is actually going to launch our new spirituality and religion special interest group. And they will be presenting 3 new studies on spirituality and religion in palliative care with our SIG co-leaders, Doctors Alexia Torkey and George Fitchett. That'll be March 6th at 3 p.m. Eastern, and we hope to see you for that. We'll also be sending out a quick evaluation, takes about a minute or less for today's webinar. So we hope that you please fill that out and let us know what you'd be more interested in learning about. Again, these slides will be posted on the website, so all of the resources that our panel provided today are available to you. So thank you again to our panel and for everyone for attending, and take care, everybody.
Great, thank you.